So we are only 3 weeks out from her buttock lift, buttock reshaping, thigh front lift, outer thigh lift. Our patient is from Europe. She had a beautiful tummy tuck, so there was no need to do that. We did remove a little bit of fat from the umbilicus to make it into an innie, but our incision essentially starts here and then goes all the way back. We cut her previous tummy tuck incision out and gave her a new incision. Through this incision, we removed the excess tissue from this region like this. As we came to the sides, we continued removing waist and outer thigh tissue, lifted it up, did a structural correction of the outer thigh lift, thigh front lift, and buttock lift. Structural correction means that the whole structure is dissociated from the muscle, lifted and put back, and that's what gives you longevity of the results. And she's doing extremely well. She's staying in LA, but is back today for a follow-up, and she'll be with us for a few more weeks before she flies back home. So my patient is about to go back to Europe, and today is her last visit. She's been here for 4 weeks. So this is her incision on this side, nice and thin, and the redness will continue to become fainter and fainter over time, and it may take about a year. The redness represents blood vessels growing into healing tissue. It always goes away as you heal. There you go. Looking pretty amazing, to say the least. Our patient has had a lower body lift, and she just reminded me it's been 2 months, and now she's going back to Florida. She's healed immensely well, and I'm super proud of her new navel. So we did a lower body lift revision, and she had a tiny navel. It was like a pencil. So we fixed that, and that was probably the hardest part of the surgery. The rest of the surgery is obviously not that complicated. Let's look at your backside that we are both very proud of. And these are her buttocks. What do you think?
I love it. I am just beyond thrilled. It turned out even better than I expected. I am thrilled.
I'm so happy. I'm really super happy for both of us.
Absolutely.
So we are looking at one of our beautiful patients. She had a 2-stage total body lift that included her arms, breasts, and then a lower body lift. She's got a beautiful high definition tummy tuck. Again, my own pioneered procedure. We've lifted her thighs, we've lifted her outer thighs, pubic area, and you can see how beautiful her back looks now. And all of that was done through this, look at that incision, barely visible. So healing really well, a beautiful result, and the best, a beautiful body that at this age I think she would be very happy with, right?
It's fantastic. I absolutely love it. I'm so glad I did it.
Well, I'm happy for you too, seriously.
It is life-changing.
Yeah, thank you.
It's nice to be proud of the good work that you did.
Thank you very much. So we are looking at one of our beautiful patients from Oregon. She's back for a follow-up, 5 months out from a lower body lift. She lost about 10 pounds of weight with Mounjaro. So essentially Ozempic body, Ozempic butt is what people refer to this. A lot of the weight was lost from her muscles. So she got some muscle wasting, especially in her buttocks, and that really led her to us. We ended up doing a thigh lift, outer thigh lift, buttock reshaping, buttock lift, and lower abdominal skin excision, Thighplasty, and lower abdominal tummy tuck. And you can see how beautiful she looks. I'm gonna rotate you, and you can see how much of the weight and the correction of the butt she has retained. We've lost some of it, but she's retained most of it. What she has retained is going to be permanent. The upper butt is filled up with her own lower back flap, and the lower butt has transferred fat. So this is now permanent. These are her incisions. I'm going to rotate you again. The incisions are placed in such a way that she can wear a thong and hide them, and you can see how beautiful her contour has come to heal. You like it?
Yeah, I do. I'm really happy. Thank you.
I'll make you sweat.
I wanted you to see how beautifully our patient is healing. She had a lower body lift back at home area in the East Coast about 14-15 months ago. And she presented to us with areas that she wasn't happy with, which were
the skin laxity of the thighs, the back of the thighs, the side of the thighs, the buttocks was not taken care of. There was just 2 inches of loose skin removed around the circumference of the body with no pull-up or anchoring to make sure that my body was lifted. So very disappointing.
I'm so sorry to hear that. So she presented to us, and 3 weeks ago we did a comprehensive lower body lift redo on her that really went after all the problem areas and every enhancement that she needed. Tell me what the difference is.
Oh gosh, night and day. The front of the thighs, there's no laxity, very tight, very youthful, no wiggling when I walk. The side of the thigh, there's no saddlebags. It's straight, narrow, it's exactly like I liked it. And then the buttocks went from, if you imagine a triangle shape, where the buttocks was wide and saggy with the saddlebags, now it's tight and round and voluminous. And very appropriate size for my body figure.
Perfect. So you can see how beautifully she's healing. She's still healing. Very bruised, obviously, and some of this bruising has to do with the fact that we did a more comprehensive buttock lift on her, and that creates bruising. Same with the thighs, same with the outer thighs and the front of the thighs. So the way I do this is that I elevate the fat over the muscle and anchor it at a higher position. So it's very similar to what many people refer to for face, like a deep plane facelift. This is like deep plane body lift, restoring the whole fat unit higher and then cutting the skin rather than just cutting the skin and the fat and suturing it, which is more or less the standard lower body lift. Ours is more comprehensive. More healing is needed. She had sagging of the outer buttocks. Those were also fixed. I put sutures here to create a little bit of a crease here for her. I've been doing this since 2005. We are in 2025 and it's taken me 20 years to get here and be comfortable with doing really comprehensive body lifts.
Fantastic.
So we are 1 year out from a lower body lift. Since her surgery, she's lost 18 pounds of weight, and I just wanted you to see how beautiful her incisions are. So if the incisions are raised, see what happens after a year. You can hardly see them, right? And this is what we are doing on the operating room table. We are putting the incision like this, deep down, so that they are raised, so they take the tension off. And as you take the tension off, as the patient heals, it flattens and it becomes a very, look at how thin this line is. Now, if it starts like this and then spread as a result of tension, then you're gonna have a widened incision. And that's why we invert the incisions at the time of the closure, so we end up with beautiful scars like this. Every scar heals differently. Scar in the front where there's a lot of tension, movement, the thigh is moving, the abdomen is moving, is scar that can widen, and that's why you want to invert the incision even more when it comes to certain scars. But see how beautiful it is. So I wanted to give you an update on our patient before she goes back to Hong Kong. She's been here for 3 weeks, healing really well. And she's been taking a bunch of peptides. So far so good. We are not out of the woods. Recovery takes about 6 weeks, but so far very nice. Tell us what you had before you came to us.
I'd had an
Abdominoplasty.
yeah, which was slightly extended to come around here.
Yes.
I had also had a BBL done to try
Yeah.
and again lift the skin through putting fat here, but didn't get the results I wanted. And I'd had the inner thigh lift, and again that had migrated down through the labia, so down the inner thigh and also at the back as well.
Yeah. So she had her inner thigh lifted, back of thigh cut, BBL to really fill her buttocks up, and a tummy tuck. So what we ended up doing is to convert everything into a high definition tummy tuck. We obviously didn't have to do her tummy tuck again, but we did a revision, scar revision in the front there. And look at how beautiful she's healing. I didn't have to cut her inner thighs again. So we lifted the inner thighs through a different procedure that I offer. Sometimes I don't have to cut people. This is the front of her thigh that is elevated, the outer thigh that is elevated. This little hole represents where the drain came. The drain went into her buttocks. So we put a flap here. The flap will go down. Obviously right now everything is swollen and bigger, but this flap will go down and will probably end up with this. We put fat into her buttocks, and then I corrected the placement of the posterior thigh. It's over corrected so that as the incision drops back and perhaps migrate a tad, it's still going to be covered by the buttock, meaning that when I do the posterior thigh lift, posterior means back, lifting the back of your thigh, which we did for her, I try to secure that incision and that placement and reconstruct the infragluteal crease, the crease underneath the buttocks. And this is her prior incision. You see the end of her incision? So I didn't even cut all of this. I tried to keep my incision to underneath her butt, but this is remnant of the previous work that was done on her on that side and on this side. I mean, she scars remarkably well, but the scar comes another inch on each side. So was it worth coming all the way from the other side of the planet?
1000%.
And what peptides are you taking?
I'm using a mixture, ones which you recommend, BPC 157, GHK 200, and there's a third one, TB 500.
Right. And you believe that it's making a difference, right?
I think it makes a huge difference. That nutrition, following your instructions to the T, your pre-surgery protocol, I think was really beneficial. All of the nutrients you recommend,
right?
And doing that before and after, I think all of it holistically together makes a big difference.
Every aspect of this makes a small difference. Once you add it up, it makes a tremendous difference, and it's all important. And as I tell everyone, recovery is half the surgery. Following instructions is half the surgery, and she's an example of that. 3 weeks out, and we are doing really yes.
No, I'm super happy, really happy.
Thank you. 3 weeks from a vertical thighplasty, that's this incision. I wanted to show you this because there is really no age limit for surgeries as long as you're healthy and follow instructions. And she's done that, and she's got a caregiver, and everything is going amazingly well, and I'm super excited for her. And that's her backside. So, and her incisions. These are her incisions, only 3 weeks out, so still healing. But you can see already how thin these incisions are, and they're flattening. So a lot of the times these incisions may be a little bit wavy to start with or raised, but they do flatten within a few weeks' time. So far, so good. So we are 1 month out from her arm lift revision and vertical thighplasty, which is a thigh reduction. Our patient last year had a lower body lift and a lot of corrective surgeries done, and now a month ago she underwent reduction revision. The incisions are barely visible from the back, but look at her beautiful buttock that we've put together. Regarding the thighs, last year we did a lower body lift. As I mentioned earlier, we pulled the outer thighs, we pulled the front of the thighs, but we didn't actually do any work on the inner thighs, and we didn't do her vertical thighplasty redo at that time. She planned to have it done this year. The problem here was the fact that someone had actually done a significant amount of liposuction of her inner thighs, creating a step of deformity. And honestly, the thighs were deformed, unfortunately. And she had been living with that deformity for about 8 years. So it's now fixed. and it looks beautiful, and it's only 1 month out. And you're happy, huh?
I'm very happy. I'm very happy.